Today we're going to be talking a little bit about the respiratory system. Why should you listen to me talk for the next 10 minutes? Well, because your body is populated by around 100 trillion cells. Without oxygen, these cells will die. The respiratory system delivers oxygen to cells and removes waste. Failure to do so will result in hypoxia and ultimately cell death. This begins with the upper respiratory tract. The nose is the main conducting airway for inhaled air and is supported by the nasal bones. Air enters through paired nostrils on the inferior surface. From the nose, air moves into the nasal cavity. This is the internal space behind and above the nose. It is divided into the left and right portions by the nasal septum. The posterior portion is continuous with the pharynx through the internal nares. The nasal cavity has functions in filtration, conditioning, and olfaction. It also works to warm and humidify the air that we breathe, and this needs to be done before the air reaches the lungs. As far as filtration, there are vibrissae that trap particles from passing through the nasal cavity. The nasal cavity also has mucin, which traps fibers so that they don't pass through the nasal cavity. These mechanisms are important because we don't want this debris to get into the lungs and interfere. The paranasal sinuses communicate with the nasal cavity and also help to warm and humidify air. Essentially, the paranasal sinuses are four paired, air-filled cavities, and they're called the frontal, ethmoidal, sphenoidal, and maxillary sinuses. Like the nasal cavity, they are lined with epithelium that produces mucin. The pharynx or throat is a common space that is used by both the respiratory and digestive tract. It transports air, food, and drink. The pharynx is partitioned into three adjoining regions, known as the nasopharynx, oropharynx, and laryngopharynx. From here, we will now move into the lower respiratory tract. The larynx is a tough, flexible segment of the respiratory tract and allows air to be conducted from the pharynx to the trachea. It is made up of several cartilage structures, including the thyroid cartilage and cricoid cartilage. The larynx contains the vocal folds that play a role in speech and the epiglottis, which can cover the larynx and prevent food from passing through and interfering with respiration. From the larynx, air moves into the trachea. The trachea is a long tube made of C-shaped cartilaginous rings. It connects the larynx and bronchi and provides a clear path for air to pass through. It is lined by mucus cells and cilia, which can make and move mucus to help move debris out of the system. Next, we move on to the bronchi. Bronchi carry air from the trachea to the lungs and split into many divisions. First, there is the primary division, where it splits into the right and left branches. These branches run into each lung before splitting again in the secondary division. Inside the lobes, they split in the tertiary division, and from there they split into smaller bronchi. Brings me to the question, why do you think the bronchi divide and split so many times? The answer to this question foreshadows what we're going to talk about in a minute. As the bronchi divide, they increase the surface area that they have. The bronchi will eventually end in alveoli, which are essential in gas exchange. A greater surface area allows gas exchange to occur more easily. The primary bronchi are made of C-shaped cartilaginous rings, and as you go down into the secondary and tertiary bronchi, there's less cartilage and more smooth muscle in the walls. This smooth muscle can constrict or dilate to regulate the amount of airflow in the lungs. The bronchi branch even further into the bronchioles, which conduct air into the alveolar ducts and the alveoli. The walls are made of smooth muscle, allowing for bronchoconstriction or bronchodilation to regulate flow, and the bronchioles are lined with simple cuboidal epithelium. The terminal bronchioles mark the end of the conducting portion. They lead into the respiratory bronchioles, which is where gas exchange begins to occur. The respiratory bronchioles connect terminal bronchioles to alveolar ducts, and they have alveoli rising from part of the wall to allow gas exchange. Alveolar ducts connect the respiratory bronchioles to alveolar sacs. These tiny ducts have alveoli that rise from part of the wall, and the distal end terminates in the alveolar sacs. This allows for gas exchange. We've mentioned alveoli a couple of times, but what are they? Alveoli are the site of gas exchange. They're surrounded by capillaries and lined with squamous epithelium. In gas exchange, the gases move through the process of diffusion, oxygen moving into the blood and waste moving out of the blood. Let's stop for a minute and think about a question. Why might the alveoli be lined by squamous epithelium? The answer to this question is that, as we have learned, squamous epithelium are flat and thin, and this allows for diffusion of gases to occur more easily and efficiently. Alveoli are located in the respiratory portion of the tract. This includes the respiratory bronchioles, alveolar ducts, and alveolar sacs. As you can see in this diagram, the tan sacs represent alveoli. In exhalation, air passes out through the same way that it came in. This happens after gas exchange, and the air exiting contains CO2 waste and is deoxygenated. As you can imagine, if we had air going both ways through this one tract, it might cause some issues. However, this doesn't happen because breathing is cyclic. So what this means is we breathe in the process of inhalation and draw air into the lungs, and then gas exchange happens, and we breathe out in exhalation, forcing gases out of the lungs. Looking at the mechanics of breathing, breathing essentially happens due to changing in pressures of the thoracic cavity. Air will always move from areas of high pressure to areas of low pressure. In order to change the pressure in the thoracic cavity, we use our muscles. If our muscles increase the volume in the cavity, this will cause a decrease in pressure. If our muscles decrease the volume in the cavity, this will cause an increase in pressure. There's a few different types of breathing, and different muscles are involved in each type. We will focus on quiet breathing, but there is also forced inhalation and forced exhalation, and these are used when there's an increase in tidal volume, such as during exertion. So in this case, more muscles are used, and the muscles that are also activated are called the accessory muscles of breathing. Now let's look at the muscles involved in quiet breathing. Inspiratory muscles include the diaphragm and external intercostal muscles. These actively contract during inspiration. Expiration is passive, so what this means is that the diaphragm and external intercostal muscles merely relax and the air moves out of the body. To summarize inspiration, the diaphragm contracts and moves down, the external intercostal muscles contract, and the ribs and sternum are elevated. This causes an increase in volume, which decreases the pressure in the lungs, and air is drawn in through inspiration. To summarize expiration, the diaphragm and external intercostal muscles passively relax. The ribs and sternum become depressed, and the decrease in volume causes an increase in pressure in the lungs. This causes air to move out of the lungs in the process of exhalation. In forced exhalation, several accessory muscles are activated and contract to help decrease the pressure by increasing the volume of the thoracic cavity, thus drawing air in. These muscles include the sternocleidomastoid, scalenes, serratus posterior superior, pectoralis minor, and erector spinae. In forced exhalation, there are also a few more accessory muscles that contract to help increase the pressure by decreasing the volume of the thoracic cavity and pushing air out. These muscles include the transversus thoracis, serratus posterior inferior, internal intercostal, external oblique, and transversus abdominis. Thank you for listening.